As a nurse in the frontline, economic power of care speaks directly to the vital role we play, not just in healing individuals, but in supporting the broader health of our communities and our economy. Every day, our work helps reduce hospital readmissions, it improves patients' outcome, and it keeps the healthcare system functioning effectively. To me, this theme is a call to acknowledge that investing in nurses isn't just a moral imperative, it's rather a smart economic decision that leads to healthier population and a more suitable system.
Okay, now how do nurses contribute to the healthcare systems in ways people might not immediately realize?
Nurses have a lot of roles in the community that people don't usually realize. Like they contribute to the healthcare systems in a lot of profound ways that are beyond just bedside care. For example, nurses are coordinators. We actually coordinate the care of patients between the different members of the healthcare profession. We also do coordinate for patients follow-ups and other services. And we are also patients advocacy. We make sure that the patient's rights and the concerns are considered in decision making. We also have a role we are also educators. We provide essential education on different diseases, different lifestyles, and those that helps to keep the patients, our community healthy.
Okay.
We are also innovators and so many other roles, which in all together help to improve patients' outcome, and then they promote health and help the healthcare to be more efficiently and more accessible.
Now, Selma, we often talk about the importance of investing in healthcare, medication included, and so on. But what does investing in nurses specifically mean to you?
Supporting and investing in nurses' well-being is not just beneficial for them. It strengthens the entire health system and economies. And therefore, I think it's an important part that should be done.
Okay. Now, what changes do you think are needed to better support nurses and recognize the value of their work economically and socially?
I think one of the things that can be done differently is like improving the compensation. Like the nurses should be paid in line with their responsibility and complexity. We also need to look at safe staffing ratio, because if you currently look at the nurse-patient ratio, it's way beyond what it's supposed to be. So we are overworked, and then we also just need greater autonomy and respect. Like nurses should have more authority on decision making, especially the nurse specialists. And then a lot of investments still need to be done in education and career development of nurses. We also need a lot of mental health support, because our profession is not an easy one. We face a lot of level of stress and trauma, and we therefore require access to counseling and debriefing programs. And I think public recognition and media representation is also a way of giving us morale and encouraging us to do better. Also, being involved in policy making. I think that those are a few things that could be done to improve the social and economical lives of the nurses.
Now, can you share a moment in your career that reminded you why nursing is an important job?
I think I'll share the most recent one. I'm a nurse that works in the labor ward, and recently, I was nursing a very young teenage mother, and I was nursing a very young teenage mother who was in labor. She was very. It was her first experience in labor, so she was very terrified. She didn't have much support from her family. So I remember that day I had a long shift. I was with her throughout the whole labor until when she delivered her normal baby, her healthy baby. And she was so thankful to me. She was crying throughout, but at the end, she was very happy, and she was thanking me. She was so thankful to me. So when I saw how happy she was, it just reminded me that nursing isn't just about mainly clinical care. It's also an emotional part, like where we in bringing life into the world and providing strength and providing support to the people that feel like they are alone and they can't make it. So yeah, that's one of the moments, just recent one.
What are some misconceptions about nursing or nurses that you'd like to clear up today?
One of the most common one is where they say nursing is a female-only profession. I would just like to say that nursing is for everyone, regardless of their gender. Men have been and continue to be a vital part of our profession. We have a few male nurses now, and they play a very important role in our profession.
During tough times like the COVID-19 pandemic, what kept you and your team going? What was motivation behind being strong for the rest of us?
COVID-19 was one of those very, very tough moments, especially for us here in the coastal areas. And what kept us going was we had a very deep sense of duty that we owed to our patients. We got a lot of support from our colleagues. We got a lot of support from the management. We got a lot of emotional strength drawn from making a few patients. We made a difference in their lives. Some of them regained their health and they were cured. And the teamwork, there was a lot of teamwork. We had a very good teamwork. Our families also supported us. The community supported us. They provided donations in forms of food, blankets. We were always given parcels as a token of appreciation, and that encouraged us to keep showing up even when we were so exhausted or we were afraid.
Okay, now Selma, how are you going to be celebrating International Nurses Day this year?
This year's International Nurses Day will be celebrated on the 12th of May under the theme, Our Nurses, Our Future, Caring for Nurses Strengthens Economy. Okay? Now this theme that was set by the International Council of Nurses, it emphasizes the importance of supporting the health and well-being of nurses to ensure robust healthcare systems and economic stability. And in alignment with this theme, we'll be having a small gathering at the hospital with various speakers, motivational speakers, and we'll also have a few well-being activities. There will be prize givings, and all this will just be aimed at acknowledging the efforts and dedication of nurses.
Okay, now Selma, finally on this International Nurses Day, what's your message to fellow nurses across Namibia and the world?
I just want to remind the public that nurses are not just caregivers. They are the advocates and they are the backbone of our healthcare system. And I would just like to urge the community to honor their work, not just in thanks, but with support, resources, and respect all year long.